Does that sound like it's a good act? No, it does not. So next we have Dr. Chris Kind. He's a naturopathic doctor. Chris Kind is an esteemed naturopathic physician who holds true to the philosophy of practice of naturopathic medicine as taught by his elders. He's a skilled clinician, a knowledgeable teacher, and appreciated by his colleagues. His leadership in the profession has seen him serve as director and president of the BC Naturopathic Association from 2003 to 11, as well as director and board chair of the historic National University of Natural Medicine in Portland, Oregon. Oh, I went to school in Western States where we were neighbors. 2014 to 21, beginning his 38th year of full-time general practice in the Comox Valley on Vancouver Island, he supports the body's natural healing ability using both the simple and traditional natural cure of hydrotherapy alongside a broad range of advanced interventional modalities in treating acute and complex chronic disease. So, round of applause for Chris.
Yeah. Thank you, Bruce, and thank you, John, for organizing this. I really appreciate your efforts, and it was astounding to observe question period today. It actually reminded me of a quote from George Orwell. He was talking about politicians and the language they use, saying something like, well, you can hear this in the way questions were not answered, not even intelligently, in my opinion, but Mr. Orwell said in 1948, he said that politicians strive to make murder sound respectable and bring solidity to pure wind. And aside from the two gentlemen standing here, I heard a lot of wind today. But I do want to talk about this act. This act is very concerning, particularly for patients. We heard today in the chamber, and you're all aware that there are many urgent care centers, ERs that are closing down. This is a staff issue. This is not more money. I heard Minister Dix talk about, oh, well, we're giving so much more money to the Vernon Clinic that's going to be closing down and blah, 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 blah. It's not a money problem. This is a staff problem. We have over 4,000, I'm not sure what the number is, 4,500 healthcare workers that were fired because they were not vaccinated. They chose to look after their body. We talk about free choice and my body, my choice. These are important issues. And we are not inviting those workers back. And so we're inviting now foreign workers. Thank God we have that interest. But when you have an act like this in British Columbia, and you have equal opportunity for any of these healthcare workers to work anywhere in Canada, why are they going to come to British Columbia? Why are they going to come here and suffer with not being able to look after their patients properly? We hear about safety, and this is all about safety for the public. Well, you certainly have safety if you annihilate the profession and there's no more profession to keep your people safe from. That's safety, but that's certainly not patient care. In my practice, I am seeing more urgent care than at any time in the 37 years that I've been practicing. I saw a fellow yesterday who was kicked out of the ER because he was a bit obnoxious. He has a clot in his leg. He has gangrene developing in his little toes. He was kicked out because he refused to wear a mask, even though it's not mandatory. He was not given any follow-up. It was not recommended to him that he should, check in with another physician. He does not have a family doctor. I had seen him a number of years ago, so he thought, oh, well, I guess I'll go see Dr. Kind. So he shows up at my office. I have to deal with those things. I'm not going to turn somebody away. The issues of safety also go to the whole issue of people in British Columbia and across Canada, but particularly British Columbia, are dying while they're waiting for appropriate medical care. That is not safety. That's not anything, and that's really obscene in my opinion. Or what we will do to keep people safe, we'll send them to the United States to get care, because we can't handle it here. This act does nothing to improve healthcare for British Columbians, and we're seeing it continue to be devastated. The issues that the previous speakers have brought up about the legal requirements and the stress on how I might decide to have conversations with my patients. Medicine is always about individualized care. It's always about the one person sitting in front of you or standing in front of you that you have to deal with. And if I don't pay attention to their individual needs, I am not looking after them at all. And to be mandated to use treatments that are not appropriate for an individual, it certainly does not respect the safety and the health of that patient. So there's lots that I would love to say. I'm going to keep it short, but this act needs to be repealed, absolutely.
Thank
Thank you
you.
very much.